Welcome to Switzerland. Did you know that our country is not just a great place to visit, but also your first-class business location? We are centrally located in Europe and we have the world's best infrastructure. Oh, and the train is always on time, so let's take a journey. Did you know that Switzerland has 4 official languages? Ja? No? Forse? Decidia? Don't worry, we also have excellent English skills. However, we don't spend all day chatting. We love to work. In 2012, we could have voted for longer holidays, and we voted against them. It's crazy, isn't it? But we're not crazy. Our economy and government are among the world's most stable. That, combined with our outstanding talent pool and a deregulated labor market, makes Switzerland the most innovative and competitive nation in the world. Our Swiss dual education system provides an excellent mix of both vocational education and apprenticeships. Now let's take a look at industry. Maybe Germany, the United States, and China are well known for their industrial output. But did you know that Swiss industrial production per capita beats all of them? Sorry, guys. Our country is small, but hey, 3 Swiss companies are among the global top 20 most valuable companies. Furthermore, we offer the best quality of life. That's why 3 Swiss cities are among the world's best for the highest quality of living. In addition, Switzerland is one of the happiest nations on the globe. Perhaps because we eat on average 12 kilograms of chocolate per year? Switzerland is the best location for innovation, has stable political, economic, and financial conditions, has the highest living standard, and welcomes your business. So tell us now, when will you invest in Switzerland? Switzerland Global Enterprise, enabling new business. Find out more at s-ge.com.
For us in the Aditya Birla Group, Odisha has been one of our most preferred investment destinations. Chief Minister Shri Naveen Patnaik's exceptional leadership has been the singular factor in the rapid progress of Odisha. The state government has leveraged its competitive advantages, including its progressive policies and governance framework, are a big pull factor.
I welcome you to Odisha. Come, join the Juggernaut.
In healthcare, a vast ecosystem is helping therapy innovators become more patient-centric and more effective than ever before. Cytiva supports researchers, biopharma, and clinicians in the pursuit of more targeted treatments. In discovery, speed and accuracy are everything. The faster and smarter researchers can work, the more patients benefit. To ensure that new, more targeted therapies become reality, we're equipping biomanufacturers with the tools and expertise they need to produce cost-effectively and quickly. How can tens of thousands of individualized patient doses be manufactured quickly, efficiently, and securely? The answer, with a healthy dose of expertise and innovation. We're creating processes and solutions that are scalable and address complex needs. We work to deliver diagnostic tools and other technologies to bring the right therapy to the right patient at the right time, so that life-saving medicines come within the reach of more people and could save more lives. Cell culture, protein purification, biomarker imaging, and analysis. It may not be what most think about when envisioning the future of healthcare, but this is what we do. Our part in changing the world. Advancing and accelerating. Discovery, manufacturing, diagnostics, future therapeutics.
road to regulatory compliance is long and filled with choices. With a combination of standards, process, and service, USP can help guide your path to compliant, quality products. Trust the standard that sets the benchmark for medicines. Our robust and collaborative scientific process is part of our comprehensive approach. We offer reference standards that are tied to USP monographs to help you minimize risk and enhance your confidence in compliance. Reduce time and resources spent developing in-house standards and streamline your path to regulatory compliance. We work with independent, volunteer scientific experts who rigorously review and approve our standards, which undergo testing by USP and other laboratories around the world. Ongoing testing of our standards helps ensure the quality of your product over time, and only USP reference standards are linked to official USP NF monographs that provide specifications for the identity, purity, and potency to meet FDA requirements without further in-house qualification and the needs of our global customers. With USP, you have access to our in-house scientific experts to guide you every step of the way. In addition to our best-in-class USP reference standards, we offer training, education, and other services. Our online resources help smooth your path to regulatory compliance. Our standards provide precise testing and validation guidelines, as well as reference samples for testing. Drugs can be made consistently every time. We are more than reference standards. We provide a unique combination of standards, process, and service. From buying to applying standards, we support your bottom line with reference standards that have been rated best in class by our customers. Talk with us to find out how we can help you navigate your journey to regulatory compliance. Contact USP at usp.org.
Welcome to Switzerland. Did you know that our country is not just a great place to visit, but also your first-class business location? We are centrally located in Europe, and we have the world's best infrastructure. Oh, and the train is always on time, so let's take a journey. Did you know that Switzerland has 4 official languages? Ja? No? Forse? Decidia? Don't worry, we also have excellent English skills. However, we don't spend all day chatting. We love to work. In 2012, we could have voted for longer holidays, and we voted against them. It's crazy, isn't it? But we're not crazy. Our economy and government are among the world's most stable. That, combined with our outstanding talent pool and a deregulated labor market, makes Switzerland the most innovative and competitive nation in the world. Our Swiss dual education system provides an excellent mix of both vocational education and apprenticeships. Now let's take a look at industry. Maybe Germany, the United States, and China are well known for their industrial output. But did you know that Swiss industrial production per capita beats all of them? Sorry, guys. Our country is small, but hey, 3 Swiss companies are among the global top 20 most valuable companies. Furthermore, we offer the best quality of life. That's why 3 Swiss cities are among the world's best for the highest quality of living. In addition, Switzerland is one of the happiest nations on the globe. Perhaps because we eat on average 12 kilograms of chocolate per year? Switzerland is the best location for innovation, has stable political, economic, and financial conditions, has the highest living standard, and welcomes your business. So tell us now, when will you invest in Switzerland? Switzerland Global Enterprise, enabling new business. Find out more at s-ge.com.
For us in the Aditya Birla Group, Odisha has been one of our most preferred investment destinations. Chief Minister Shri Naveen Patnaik's exceptional leadership has been the singular factor in the rapid progress of Odisha. The state government has leveraged its competitive advantages, including its progressive policies and governance framework, are a big pull factor.
Welcome you to Odisha. Come, join the Juggernaut.
So good evening, everyone in India, and good afternoon to all the participants joining from Sweden. I hope that we have everyone here, and as we are a little bit short of time today, so I think we start immediately. I'm Niklas Jakobsson, and I'm heading the international division here in the Swedish Ministry of Health and Social Affairs. And I have the pleasure of being your moderator today. Let me start by thanking the Department of Biotechnology, BIRAC, ABLE and CII for inviting Sweden to co-host this session on precision medicine together with you. Sweden and India have a long and strong multifaceted collaboration in many sectors. We are guided by a common memorandum of understanding on cooperation in the field of healthcare and life science and innovation. A very successful partnerships with which we can take stock in when moving ahead. I've been part of the Swedish-India health collaboration for a very long time. And in 2019, during the India-Sweden Year of Health, we celebrated the 10th year anniversary of our MOU in connection with a special ceremony in connection to the state visit by the Swedish King and Queen to India. Both countries agree that this is one of the best collaborations and friendship we have. The pandemic has shown that we must build new partnerships between public actors and the private sector and find innovative ways for business, investments and innovation to contribute to sustainable development. I'm sure that today's discussions can lead to enhanced collaboration in a new thematic area. I know that we have much to learn from each other's knowledge and experiences, and not least from this ongoing pandemic in the years to come. With that said, I would like to welcome you all to this session on precision medicine and data-driven life science. Before I introduce our first speakers, just some housekeeping rules to be aware of. So please keep your microphone muted when you're not speaking. Since there is an extensive list of speakers and panelists today, I will keep the introductions of the speakers short, but the bios are available for anyone interested. And to all the speakers, please let's help each other to keep track of the allotted time so that everyone gets the chance to speak. We will have some minutes by the end for the observing participants to ask some questions. So I would now like to welcome the Swedish ambassador to India, Mr. Claes Molin, to do his remarks. Please, Ambassador.
Thank you very much, Niklas, and good afternoon, good evening, everyone. It's a pleasure to once again have the opportunity to address a very eminent group of scholars, researchers, etc., within the realms of innovation and indeed healthcare and life science. It's not for the first time, as I know you know, and echoing some of Niklas's remarks, of course, these are innovation and health are perhaps the two strongest drivers at the moment in our fantastic and very dynamic bilateral relationship, the one between Sweden and India. That goes back a long time, but I think looking at innovation is in its third year of an innovation partnership for a sustainable future. Let me, before I continue with very brief remarks, recognize, of course, my counterpart, Ambassador Tanmay Lal in Stockholm, Dr. Renu Swarup, of course, Dr. Jenny Nordberg, Dr. Alka Sharma, who will be addressing you shortly after this introductory section. But let me really emphasize how happy we are to do our part in bringing partners together from both sides in so many different ways. This area, of which I am absolutely not an expert, precision medicine, I think promises, given our respective strengths and the possibilities of cooperating with data, with life science, from various parts has great potential. And I, for one, am looking very much forward to following the discussions, the results that will follow, and rest assured that we on this side, certainly the embassy, but I know the government of Sweden as a whole will be very excited in taking part in whatever may come of future collaborations. So I'll leave it at that in the interest of brevity, and wish all the participants the best of luck. As we are very focused on many similar areas during this very extraordinary year of the pandemic. Also, as a parting note, congratulate the government of India, DBT, BIRAC, etc., for the rollout of the vaccinations that is taking place as we speak all over India, and with the help of India in so many other places in the world. Thank you very much.
Thank you very much, Ambassador. Next, we are very pleased to have with us also the new Indian ambassador to Sweden, Ambassador Tanmaya Lal. We're pleased to have you on board of our health and life science cooperation. So thank you for being with us today. And please, the screen is yours.
Thank you, Mr. Jacobson, Madam Secretary, my colleague, Ambassador Molin, and all the participants. Greetings from Stockholm. Having been a student of biosciences and genetic engineering, although 3 decades ago, it is especially exciting for me to see that life sciences and biosciences and healthcare are really one of the most prominent areas of India-Sweden interaction. It's long-standing collaboration really, and it's going ahead very strongly. As was mentioned, the global pandemic has put this area of research and application firmly in the spotlight, not only today, but for times to come. And we see that public-private partnership in the last 1 year or so has really been intensifying all over, including in India. And people are looking towards researchers and entrepreneurs for solutions. Sweden, of course, is famous for its triple helix system, which draws its analogy from biology, biosciences. And all of us know that our understanding of the nature and ability to find solutions has completely been transformed by the discoveries or the researches to find the gene, to the atom or the information byte, so to say. The scientific research is increasingly multidisciplinary. So our rapid advances are not only, they are greatly enhanced by the insights, not only of physics and chemistry, but of mathematics, data analytics, simulation, artificial intelligence, and so on. And this really is transforming this sector. India and Sweden, as has been said, bring synergies in terms of varied areas of scientific research and innovation. And these are obviously translating into development solutions and investment. It is great to see the Department of Biotechnology and associated institutions and industry identifying joint collaborative efforts through research, innovation, and investment, especially with our Swedish friends and partners. This continues to be an area that offers great promise for our future collaboration. And I look forward to a very engaging session. Thank you very much.
Thank you so much, Ambassador. We're very much looking forward to take the Sweden-India health collaboration to the next level. Before we dive deeper into the topic, we have the Secretary of the Department give her remarks. Dr. Swarup has actively contributed in the formulation of India's biotechnology vision and strategy. Please, Secretary, the screen is yours.
Thank you very much, and a very good evening to all of you. It's wonderful to see all friends here. Excellency Claes Molin, a good and dear friend of India, of our India-Sweden program, Ambassador from Tanmaya Lal from India in Sweden. I think you have very correctly said how the India-Sweden relationship is so important to take forward the healthcare innovations, and especially precision healthcare. I'm pleased to see this speaker galaxy before me here. It's always different to be physically and virtually having these meetings. You just see a grid before you, but it's wonderful to see all these faces. I have to compliment the team which has put together such an excellent list of speakers, both from Sweden and from India. If today this rich expertise that is there before us is going to give us a very clear recommendation on what is it that we need to do. And I think this really is what we have been discussing over the past many years. And Excellency Klaus Mollin, you will recall that when we have been doing these various bilateral cooperation discussions, precision healthcare has always been on the top as one of the most important priority areas. We have our key industry leaders today from India, our key academic groups, and similarly from Sweden. It's important today, and this discussion is being held at a very important time, when in this last 1 year, when we all battled the pandemic, we also delivered wonderful solutions from science and technology. And these solutions came because of the convergence of different areas of science together, the collaborations that we saw between academia, industry, startups, national, international, all together, and most importantly, the commitment that we all put together to be able to deliver for that global cause and for that global challenge that we are all facing. We are hoping that going beyond this pandemic, we will continue with this convergence, collaboration, and commitment. And one area that requires it most is the area of precision healthcare. We have, over these last many years, been able to build a lot of competencies and capacities in excellent data generation. I think now is the time when we start seeing how we could look at the data analytics for a purpose to be able to deliver what solutions we are asking for, and precision healthcare is so appropriately positioned there. In fact, just yesterday, Anurag was giving an oration lecture on big data sciences, and I remember telling our Regional Center for Biotechnology group that we need trained human resource. So I think that's one key aspect. If we have to look at data science, if we have to look at the opportunities of data science, I would urge this group to give us a very clear recommendation while we look at research innovation programs. How do we build in training capacity building as a key component? We are moving forward. We are setting up these centers for new and emerging sciences. Data science is not an emerging science, but it's an important science. It's a new science that we need to focus on. And we would really like to see how we could build Indo-Swedish collaboration for capacity building, both in terms of human resource and infrastructure. And also looking at how do we bring out these solutions for many of the various current priorities that we have, whether it's rare and genetic disorder, whether it's the cardiovascular, whether it's maternal and child health. And I know many of our industries, and Anu is here, one of the leading women entrepreneurs, women industrialists who's taking this whole area forward. Many more. I can see Forus, and I can see many of our industries. I'm limited by the grid that I have before me, but I also see Partha Majumdar, who's been able to build a very strong foundation for our genomic research, our cancer genomics, many others. I think this is going to be an excellent opportunity for us to have a clear set of recommendations beyond just bilateral projects and calls that we put out. Building a long-term relationship on how we could use the expertise of either side to come together to deliver. So thank you very much for having me here, this initial to at least meet with all friends here, and good luck to you. I'm sure that as we move forward, India and Sweden will be able to take this very important priority area ahead. And I'm sure our ambassador, Mr. Tanmay Lal, will be able to also guide us as to how some of our programs that we have within India, we can sort of connect more with the Swedish side, and Excellency Klaus Mollin, similarly within the country, you know our strength on how we could build it. So thank you. and look forward to the recommendations of this as a part of this larger global BioIndia, which we hope will continue to strengthen as we move forward. So thank you so much, and over to you back again.
So thank you very much, Secretary Swarup, for your insightful introduction. It will indeed be of great interest to see how Sweden and India can collaborate and extend our knowledge sharing while implementing the life science strategies of each country, not least when it comes to capacity building, as you were mentioning. So the world is facing a wide spectrum of challenges related to health and well-being, even beyond this pandemic. And precision medicine targets diagnosis and treatment tailored to the individual. And joint efforts in this area will result in improved health, strengthen the international competitiveness for all stakeholders, increased export and new investments. And to help us set the scene and introduce us to the very diverse subject of precision medicine and data-driven life science, we have Dr. Jenny Nordborg from the Office of Life Science at the Government of Sweden, and Dr. Alka Sharma from the Department of Biotechnology at the Government of India. First out is Dr. Nordborg, who is the National Coordinator and Director of the Office for Life Science in Sweden. She's active in strategic innovation policy development and implementation within the health and life science on national and international level. So, Dr. Nordborg, the screen is yours.
Thank you so much, Niklas. And it's a true privilege to be able to participate at this meeting today. And I can only so much mirror what has already been said. I think that the timing is perfect, not only for talking about how we must work together facing the challenges that we currently have, but also working on building a stronger health partnership for the future, also in precision medicine. In my role as a national coordinator, I have also the mandate to have a dialogue with the sector, both on national and international basis, to implement the national strategy. And the Office for Life Sciences is a cross-ministry within government organization. The National Strategy for Life Sciences in Sweden was launched in December 2019, and that was just on where we were, just on the verge of the COVID-19 pandemic. And still now, only a year later, we have totally changed, and yet everything is but the same. Precision medicine will be a game changer for a lot of the things that we do for the future. So it will be great to be able to discuss this a little bit more further. I will take a couple of minutes to go through what these cornerstones of the national strategy of Sweden. The overall framework, and the strategy is a long-term framework, I must say. The overall framework of the strategy is precision, prevention, and sustainability. We're really utilizing the strategy also to stress how important life sciences is to meet these sustainable development goals. The first cornerstones is really on partnerships and collaboration, both nationally and internationally. We are facing new type of challenges that we haven't seen before. And we also need to speed up, hence partnerships are so important. The second part has already been mentioned so many times today. When we're moving towards precision medicine implementation, we need to utilize health data in a new way, to have health data accessible, to be able to work with real-world data and use real-world data in new ways. And I think that also the Innovation Agency, Vinnova of Sweden, that participate today can also reflect on that quite a lot. Also the usability of artificial intelligence in health data, and also reflect on the innovation in policy, which is really the third part that is needed when it comes to implementation of precision medicine. The fourth pillar of the strategy has to do with implementation and the infrastructures that we need for implementation. Genomic Medicine Sweden and Testa Center are two very strong infrastructure from Sweden present here today. Totally different, of course. Genomic Medicine Sweden works with implementing genomic diagnostics throughout our healthcare system. Testa Center is an innovation platform for building new ways for production of advanced therapies as such. We also have the challenge that we need new knowledge and to be able to attract the young talents to this area of field. And I'm happy that the Karolinska University are here with us to reflect on that. And of course, last but not least, we need to build together on international attractiveness. And Sweden is a strong startup nation, both in health and in tech, which really encompasses life sciences as a whole. So I look forward on a discussion that really tackles the challenges that we have. First and foremost, we need to shift the culture. We need to be able to utilize data in new ways, to be able to use the modes of intelligent decision support in a sensible way moving forward. We need to build strong infrastructures, but work with new type of infrastructures and also put a new focus on clinical trials and collaborations when healthcare and research happens at the same time. And finally, build partnerships also for public-private partnerships that can tackle also the financial and the economical side on that. And we also happy to have the business sector with us here today for that dialogue. With this, from the Office for Life Sciences, I so much look forward to the discussion of today. And thank you. Back to you, Niklas.
Thank you very much, Dr. Norborg. Dr. Sharma, we are eager to hear also about the work going on from the Indian side. Dr. Sharma is a senior advisor in the Medical Biotechnology Division of the Department of Biotechnology. She's focusing on research and policy issues in the emerging areas of biotechnology in the government of India, such as stem cells and regenerative medicine, medical technology of innovation, but also legislative issues such as DNA, the DNA technology bill. So please, Dr. Sharma, the screen is yours.
Thank you for a nice introduction. Thank you, Dr. Norborg. Good morning to our student participants and good evening to our Indian participants. So to take this dialogue forward, so as Dr. Sarup, Secretary Department of Biotechnology has outlined that we have a long-standing cooperation with Sweden. It is now more than a decade-long partnership. In 2018, a joint declaration was signed on innovation partnership for a sustainable future during the visit of our Honorable Prime Minister to Sweden. And this includes circular and bio-based bioeconomy, including biomaterials, health and life sciences, including biomedical devices. So based on this, now we are pursuing our joint activities for advancing the benefit of science in both the countries. Just to provide you a summary, so far we have had 5 joint calls and implemented a number of joint research projects. The collaboration has also resulted in a large number of good quality publications and a few patents. We have worked together on many priority areas on health research, clean energy, and in promoting startups and entrepreneurship across both the countries. The latest effort was digital healthcare, which is being jointly promoted, enhancing accessibility and affordability of healthcare across both the countries. We are delighted to host this special session on India-Sweden dialogue on precision medicine and data-driven life sciences in this Global BioIndia Meet. There is a lot of thrust globally on customizing treatments as well using data and algorithm-based tools for quick and robust diagnostics. We welcome the experts from both the countries to share their views. We would be happy to take the recommendations from both the countries and especially from this group today forward in making this science a reality. Thank you very much. Over to.
Thank you very much, Dr. Sharma. I'm sure that your insights and others here will lead us into the next discussion about implementation and innovation platforms. Sweden and India have much to gain from joint policy learnings and concrete R&D partnerships and projects. In the current implementation of the Swedish life science strategy and India's launch of your new life science strategy, there is a potential to exchange research insights and data between Indian and Swedish organizations, to engage in joint training and education programs to help embed precision medicine principles in research practice, as well as at clinical, industry and policy levels. We will now hear more on how the implementation of precision medicine is taking place in both countries. First, we have Professor Rickard Rosenqvist Brandell, Director of the Clinical Genomics Platform within Science for Life Laboratory, the so-called SciLife Lab. He leads Genomic Medicine Sweden, a national infrastructure for implementation of precision medicine. Professor Rosenqvist Brandell is a member of the Nobel Assembly at the Karolinska Institute. So please, Professor, the screen is yours.
Thank you very much for the nice introduction, and it's great to be part of this dialogue, and I'm very much looking forward to the discussion. In my view, and during this short presentation, I will show you how we went from precision diagnostics and now take the steps for precision therapy in order to also realize precision health. Just some background. In 2012, we started a dialogue with our national infrastructure for high throughput technologies, Science for Life Laboratory or SciLife Lab that was mentioned, how we could take advantage of the new sequencing technologies also within healthcare. Based on this discussion, we formed a platform called Clinical Genomics, which enables testing, adaptation, and implementation of genomic analysis for healthcare. And for instance, we introduced clinical whole genome sequencing in 2015 for patients with rare disease.
Professor, I think we lost you. Or is it only me? I can't hear.
I can't hear. We lost him. I can't hear him either.
Okay.
Sorry, you cannot hear me?
Yeah, now we hear you again.
When did you lose me?
1 minute ago.
Whole genome sequencing.
Whole genome, okay. Yes.
Now we lost you again, Professor. So maybe we should try to get back to you, Professor, because I reckon that all of us have lost contact with Professor Brandell.
So maybe we should all stop the video and see if that helps.
Yes. Det hjälper väl inte honom. So, Professor, are you with us? gå vidare.
There's a message from the professor saying he's going to try and change his network.
Okay. Maybe we should, while the professor is working on that, would it be possible maybe if we could move further to the next speaker? And please, you could join with your screens again so we can see who are with us. And then I would be pleased if we could hear from Dr. Anurag Agarwal. Dr. Agarwal is a multi-awarded researcher and director of the Institute of Genomics and Integrative Biology. So please, Dr. Agarwal, if you have the possibility.
Sure, thank you very much. I'll continue on the line of thought that we already started, that the premise of precision health is based on ability to predict better, be more preventive, be more individualized, and all of that will take data. It'll take whole genome data, it'll take clinical data, it might take many other types of omic data, but most of all, it must be representative of the population to which it is being applied. So more than a decade ago, around maybe 2008, we realized that since India was not part of the original Human Genome Project and we were a bit far behind, it was a huge possibility that the genetic diversity of India, our very different environment, our very different lifestyles and context and prior probabilities of clinical events, would be completely lost in the world of precision health if we were to exclusively rely upon data from elsewhere. I think it is very well known to everybody on the conference today that the greatest genetic diversity in this world lies in Africa. As you come out of Africa, it is probably in South Asia. In fact, the vast majority of the genomic data in this earth represents only a very small fraction of Caucasian population, and countries like India, therefore, made it a very imperative program for data generation relevant to the population. Now, this has three clear and distinct sides. First is cross-sectional data. Cross-sectional data for the population in general. And even when you sequence 1,000 genomes, whole genomes of Indians, you find approximately 12 million new variants that were previously not described. That paper was recently published as part of a work done at our labs. Very similar numbers come when you do this for Africa, but this is the level of diversity. The second is to build cohorts. To do precision health, you must have clinical outcomes tied to all kinds of deep data. And these cohorts can be retrospective if you have precise things in mind. For example, cancer, you may have biobank samples a long time ago. You may have clinical histories of people who are already under follow-up. But ideally, in precision health, you need to build prospective cohorts of large enough size to do this well. And that has led to a new national mission, a precision health mission, in which we aim not only to work on our existing capacity in the space of genomics and other omics, but to tie in to high quality, well-decided, proper strategy, long-term clinical cohorts. The third, which is the big data strategy, is to not rely only upon either cross-sectional data or upon well-planned prospective cohorts, but to simply gather all data coming out of clinical care, health, individual participants, people who use wearable devices at a very large scale. This is possible when a country has good quality electronic health records. During COVID-19, we saw a transformation. The National Digital Health Mission was approved in May 2020. One of the promises our Honorable Prime Minister has made to the country that going forward, every person will be able to digitally access their own health data. And India has done well for the foundational cross-functional pieces. We started with a national digital identity that covers over 1 billion people. We started with other building blocks involving payments that allow us to have presence-less, cashless India stack things. Now the plan is to build a health stack on top of the India stack. And the health stack will continuously accumulate data, which ethically, privately, and credential-wise be made available for research via things that will be called health exchanges, health data exchanges. This data, using newer methods, which allow you to have data and share it securely, such that algorithms move, data does not move, federated learning will be tried. And we are looking at collaboration with people all over the world, particularly with you over here today, in seeing how to make this a reality. So we have data, we share data safely, and make sure we use the right health surrogates for our population. Thank you.
Thank you very much, Dr. Agarwal, for this. I hope we have Dr. or Professor Rosenqvist Brandell back with us. And if you could please continue where we left off.
Yes, can you hear me now?
Perfect.
Very good. Sorry, I'm in the countryside, so that's why, but I tried my wife's Wi-Fi instead. So I introduced to you that we formed this clinical genomics platform within SciLife Lab, and this helped us to start doing clinical whole genome sequencing. And then in 2016, we started a discussion to form a national initiative on precision medicine, and that is Genomic Medicine Sweden. We had a pre-study in order to set the organization, and then we got an implementation grant from the Swedish Innovation Agency in 2018 to really get started at national level. And this is a national collaborative effort between the 4 pillars of stakeholders, which I think are important to realize precision medicine: academia, healthcare, industry, and patient organizations. So instead of this triple helix, I would say that we have this quadruple helix. And they are also represented in our national steering board of Genomic Medicine Sweden. So we deliver precision diagnostics within our focus area, that is rare diseases, cancer, microbiology, and pharmacogenomics. And we have formed genomic medicine centers at all university hospitals in Sweden that perform the sequencing and the clinical interpretation. And these centers also build precision medicine teams for patient-adapted treatment and follow-up. Within GMS, we initiated a national IT infrastructure that we call the National Genomic Platform. And all the genomic medicine centers are connected to this platform. It is a high computing cluster located in the west part of the country. And here we will store and share genomic data and associated data over the country. And we also plan to link this platform to our national registers. To realize the full potential of precision medicine, we also need to increase our collaboration with industry. GMS has a dedicated unit for industry collaboration with a reference group of companies specifically interested in precision medicine. So far, we have had contacts with more than 100 companies, and we have started more formal collaborations with a handful of companies, both within biotech and pharma. Coming back to SciLife Lab, a very important national research project was initiated last year, Data-Driven Life Science, with a budget of more than 300 million euros, where one of the focus areas is precision medicine. And this will be a very important way of taking advantage of all genomic data generated across the country to foster new types of data-driven research. Admittedly, although I'm a geneticist, precision medicine is not only genomics, but also includes many other aspects. In Stockholm, we recently formed the Precision Medicine Center Karolinska that includes, besides genomics, other omics technologies, imaging, data sharing, and research. And this builds on our strength in precision diagnostics, but also we have the Precision Cancer Medicine program at Karolinska for starting new clinical trials within cancer. Hopefully this will speed up the implementation of precision medicine within healthcare. I very much look forward to the discussion how we can find common areas of interest between India and Sweden, and apologies for the problem with my connection.
Thank you so much, Professor. That's fine, no problems. To be able to further implement and integrate precision medicine in the health sector, new innovation platforms are needed for precision medicine and advanced therapies. With many Indian companies now developing ambitious precision medicine research activities, the time is just right to partner up with Sweden and its strengths in areas such as molecular profiling and AI solutions. By showcasing Indian and Swedish life science solutions and the benefits of sharing platform technology and information, we will create a common ground for new innovative platforms. So now we will hear from two different innovation platforms in India and in Sweden. Dr. Lotta Ljungqvist is the CEO of Testa Center, as we heard of before. Testa Center is a major initiative between the Swedish government and Cytiva to secure the growth of the nation's life science industry and its manufacturing capabilities in particular. Please, Dr. Ljungqvist, tell us how Testa Center is operated.
Thank you very much. And a great pleasure to be here and to meet so many distinguished life science leaders from India again. I've had the pleasure to be a number of times in India managing a team of engineers in Bangalore for Cytiva and also meeting many of our customers. And during these days, I have very vivid memories of my meeting with the Serum Institute, one of the largest vaccine manufacturers present in India. Very, very impressive. And I think we're all counting on the effort that the Serum Institute is doing to help us with the pandemic. So with that, I'd like to go into more of the innovative platforms for precision medicine. So I'm managing an effort called the Testa Center, which is an effort to support growth of the life science industry. It's also focused on the manufacturing technologies, and I think you are aware of that precision medicine is very much both in terms of getting the science right, but also the manufacturing and the logistics right. The pandemic has also proven to us that scale up of biologics, it's not an easy task, so this is a science and technology that we need to continue to focus on. The Testa Center is a center which partners with Cytiva, one of the largest suppliers of tools and equipment to the pharma industry, and the Swedish government. And it's a joint effort to really make sure that we share the expertise and the knowledge and the technologies to grow the industry. Precision medicine is both biologics, traditional biologics like proteins, when we're getting to sort of smaller and smaller patient populations, but it's also cells and various versions of cells and also other types of molecules. We call it now the new zoo of molecules. So innovation is something that we need to focus on to support how we understand the treatment of these new indications. So for example, if we talk about cells, I think you are aware of that cells can now be used as treatments, and the CAR-T treatment has been approved for 2 indications, which is one of the sort of new steps to really have innovation going into implementation in the healthcare sector. And it's also now several hundreds of clinical trials ongoing in this field. So if you think about precision health, the growing cells can be very individual treatment. So taking one cell, modifying them, growing them, and then giving it back to the same patient. So it's very much sort of precision health at its utmost. And to deal with that, we need to have technologies that can bring precision manufacturing as well, at a cost that is sustainable. So we have the science, we know this can be done, but there's lots of innovation still needs to happen before we can all implement these technologies at the full level. So we also have new versions of cells. CAR-T is sort of the front in this sector. We have NK cells, we have other sort of traditional cells, and we also have the stem cells, the iPS. That is sort of a way of broadening this field so that we potentially can not only treat cancer, but cure cancer. I think that's what we're looking for. I would say Sweden is very strong in this area, both in terms of the biology and also how we combine it with technology and digital solutions. I'd like to mention one company called Cellink, which is managing the technology to actually use 3D printing of cells so that you can build organs. So it's sort of an even more innovative platform. Still lots of work to be done, but that's the range of work that's going on in Sweden, I would say. So with the precision health, I think what we have in front of us is really managing a complexity of new molecules and modalities without getting it complicated. So managing the complexity without the complication. So with that, I'm leaving it over to the next speaker. Thank you.
Thank you very much, Dr. Ljungqvist. I've had the pleasure to visit Testa Center, and it's quite amazing actually to see the resources that's in place to promote innovation. Our next speaker will reflect on the need for innovation platforms, is an international renowned breast and gynecological cancer oncologist, Dr. Sudip Gupta. Dr. Gupta is the director of the Advanced Center for Treatment, Research and Education in Cancer at Tata Memorial, one of the premier cancer translational research centers in India. So please, the floor is yours, Dr. Gupta.
Thank you very much. I hope you can hear me.
Yes.
Okay. So first of all, I would like to thank the organizers for their invitation to participate in this excellent meeting. And as you can probably make out from the stethoscope around my neck, I am a practicing physician and oncologist at the largest cancer center in India. And therefore, I will give you a clinician's perspective on precision medicine. And just by way of introduction, Tata Memorial Center registers about 60,000 new cancer patients every year, making it one of the largest, if not the largest cancer center in the world. And we are almost exactly 80 years old. Just to set the stage, the traditional way of treating cancer patients is to plan treatments for groups of patients, and groups are defined by pathological characteristics, stage, and more recently, genetic and genomic features of tumors. The outcomes are also defined in groups, for example, in terms of probabilities of being cured or surviving disease-free in the long term. We know that many cancer treatments are useful and effective, but we also know that at the group level, they increase the probability of cure by an absolute percentage of only a few percentage points, like 4 or 5%. As most of the treatments that we currently use in cancer and indeed in other non-communicable diseases are either useless or ineffective in large proportions of patients in whom they are administered. And in oncology, this applies, of course, to chemotherapy, to targeted therapy, immunotherapy, radiotherapy, and almost all other treatments. The single biggest raison d'etre for precision medicine is to deliver treatments only to those patients who are likely to benefit from it. And of course, there are many other premises of precision health, such as precision preventive strategies at the population level, as well as others. And on this background, I will enumerate for your consideration 4 oncology-related health platforms that lend themselves to collaborative data collection and modeling for precision health. So we know that radiotherapy has seen sophisticated technological advancements in recent years with platforms like intensity modulated radiotherapy, particle beam therapy such as proton beam therapy and others. We are about to inaugurate India's second proton beam therapy center in our premises in a few weeks from now. These treatments are expensive and basically aim to deliver high radiation doses to tumor while sparing the surrounding normal tissue. Now, there is an enormous amount of data that is generated from these platforms, like on-beam imaging, motion-based imaging, planned and delivered radiation doses, short and long-term cure rates, and short and long-term toxicities. And our center has just presented and published 2 important studies in cancers of the cervix and prostate in the Journal of Clinical Oncology using advanced radiotherapy techniques in 2 clinical trials. So therefore, I submit to you that systematic collection and analysis of radiotherapy data, including analysis with both conventional and AI techniques, is likely to make an enormous impact on outcomes in the coming years. The next theme for your consideration is diagnostic imaging and pathology. And in centers like ours, every day, thousands of images are generated, including those comprising diagnostic radiology, such as radiographs, CT scans, MRI scans, PET scans, mammography, and others. And we also generate thousands of pathology slides, including with techniques such as immunohistochemistry. We also generate an enormous amount of data with other techniques, such as multi-parameter diagnostic flow cytometry, and creating biobanks, including imaging biobanks that are linked to associated clinical information, is an enormous stockpile of data that is waiting to be mined, including with AI techniques such as convolutional neural networks and others. We have recently received support from the DBT for creating an imaging biobanks on the lines of TCIA for almost 20,000 images. We have surgical techniques in the next theme, where one of the cornerstones of cancer surgery is dissection and removal of lymph nodes that drain an organ. And this is done both to remove any residual cancer cells and also to guide risk-stratified post-operative treatment. But this removal of lymph nodes can also have side effects like swelling or lymphedema. And there are new techniques such as sentinel lymph node biopsy that aim to remove only the first few draining lymph nodes. Now, we also know that large amounts of data are generated in the process of mapping the sentinel nodes with nuclear medicine and dye techniques, and also associated linked health outcome data, reduction in morbidity, and associated genomic and pathological features of tumors. And again, these lend themselves to collection and joint analysis, for example, between Sweden and India, to figure out the long-term outcomes. And lastly, I will submit for your consideration the theme of population health. Our center has just published a cluster randomized breast cancer screening study in 150,000 women residing in the slums of Mumbai in the British Medical Journal, which has suggested mortality reduction by using clinical breast examination in postmenopausal women. And we know that Sweden has been one of the pioneers in mammographic screening, including the famous 2-county study. Our center has also created a large population-based cohort in a rural area of Maharashtra with collection of baseline DNA and blood metabolites of the entire population of about 200,000 individuals, which is linked to their baseline health parameters, lifestyle habits, and this cohort will be followed up for a period of about 20 to 30 years. And I submit for your consideration that such data can provide platforms for deciphering lifestyle, germline, and metabolic predispositions and other risks that are related to many NCDs, including cancers. We know that many centers are now performing germline and somatic tissue testing on an increasing proportion of patients using high throughput techniques. I would like to lastly suggest that assembly of data from several centers and across ethnicities can be a very powerful tool in this kind of research, and dialogues such as the one that we are having today are ideal to take this kind of research forward. So I thank you very much for listening to me and for your consideration.
Thank you very much, Dr. Gupta, and thank you for these very concrete proposals as well. So now we're moving into a panel discussion, and I will start by presenting the 9 panelists and then go on to each question. And since there are many panelists and we are short of time, I will be directing each question to some of the panelists, and we have just 2 or 3 minutes per question and person. So if one of you that has not gotten the question but has a comment, raise your hand or turn on your microphone and let us know before we move on. As you are asked the question, please begin by giving us just a short description of who you are. And the panelists, they are Mr. Anders Blank, Director General of LEAF Sweden, the research-based pharmaceutical industry. It's Professor Ingmar Enberg from Karolinska Institute. It's Professor Olli Kallioniemi, Director of SciLife Lab, Dr. Björn Arvidsson, Managing Director of Stunds Life Science, Dr. Anu Acharya, CEO of Map My Genome India, Mr. Lars Hammarström, Director, Division of Health and Life Science at Vinnova, the Swedish Innovation Agency. It's Dr. Amrik Mail, Head of Information Technology for Research at AstraZeneca, Dr. Parthu Majumdar, National Institute of Biomedical Genomics in Kolkata, and Professor Kuldeep Singh at AIIMS Jodhpur. On this first question, we would like to hear from Mr. Anders Blank, Professor Ingmar Enberg, Professor Olli Kallioniemi, and Dr. Björn Arvidsson and Dr. Anu Acharya to elaborate on this question. What developments do you see within precision medicine? What examples of precision medicine can you share from your organization? And first, Mr. Blank, you have the screen.
Thank you so much for the invitation to join this very important India-Sweden dialogue on precision medicine. From my perspective, I would like to highlight a few points when it comes to where precision medicine are from my perspective, and that is in addition to what already has been raised by my Swedish colleagues. I think from a Swedish perspective that precision medicine is now a much wider approach from having been almost exclusively focused on genomics to now being applied in a broader context with a whole healthcare chain from diagnostics to treatments. And that means that precision medicine is becoming an integrated part of healthcare, and the possibility of using precision medicine tools such as advanced diagnostics for more individualized treatment choices is actually a reality in several therapeutic areas such as lung cancer and rare diseases. Precision medicine, as you all know, is dependent on access to health data, but it also drives the development within the health data space when it comes to technical solutions for sharing, visualizing, AI-based decision support systems and so on. And from the pharmaceutical field, I see that we have a rapid and promising development of advanced therapies, such as cell and gene therapies, which are potentially curative treatments for severe diseases and based on precision medicine principles and approved together with accompanying diagnostics. So this whole concept of precision medicine today places demands on increased coordination and collaboration within the healthcare system, but also regarding collaboration with life science companies, but also on countries and regions working closer together. So I really welcome this dialogue today on how we can work closer together. Thanks.
Thank you very much, Anders. And now we turn to Professor Enberg, please.
you're on mute.
Yes, you're on mute, Professor Ernberg.
Sorry.
No.
I wasted 30 seconds there. Sorry, my name is Ingemar Ernberg. I'm professor of tumor biology. I have a physician medical background, but I do not see patients today. I am chairing the Precision Cancer Medicine Program, which is bringing together Karolinska Institutet, which is a state-owned university, the Karolinska University Hospital, which is in fact a regional hospital that we are collaborating with in the Karolinska University Hospital system, and the Science for Life Laboratory, which has been mentioned several times here. About 6 months ago, our organizations, the Karolinska Institutet, the hospital, and the Science for Life Laboratory, agreed on an overriding program for the whole system of healthcare, the Precision Medicine Task Force, with a very high priority, not only in cancer, not only in rare diseases, but also in over the whole arena of diseases, that precision medicine is the highest priority. And I'm very happy about that, of course, because I have, like some others here, worked with this for some time. The Science for Life Lab was put in place 10 years ago, providing us with all the technical platforms. The Genome Medicine Sweden program, as you heard from Richard Rosenqvist 4 years ago. But in spite of that, the integration between healthcare and clinical research and precision medicine research, basic research, is still a headache in Sweden. So I would say that the distance between the basic implementation of this for the patients and what we are talking about in research, it has become even longer today. And we are in Sweden actually struggling with making precision medicine reach the patients in Stockholm, in fact, and even more so if you look at the whole country. So I think this is a major thing, is that there is still a lot of groundwork to do to implement precision medicine and to convince local decision makers in healthcare system that this is going to be economically positive. A few remarks. We have introduced in our program during the last year also the patients very actively. This is a trend, and precision medicine, of course, is perfect for patient participation. We call it symptomics. So we have genomics, we have proteomics, we have transcriptomics, and now we have also symptomics. And this is much related to patient-reported outcomes of their situation. Of course, we are also very much involved in developing PCM beyond genomics in other areas. And in Karolinska, we have a very strong go in proteomics, which will be probably the next most important omics to improve and develop precision medicine. When it comes to international collaboration, we have a role model in a European collaboration called Cancer Core Europe, which is really a clinical collaborative organization between the leading cancer centers in Europe devoted to PCM. And I must say that we are completely convinced that PCM to be successful requires multi-center collaboration. It requires international collaborations. We in Sweden cannot sort out and solve this ourselves. And so far this European collaboration has much proven that. Finally, I would say that apart from the wide scope between the access to PCM or precision medicine for patients to the research front, I would say that precision medicine really puts the gray zone between healthcare system and clinical translational applied research in focus. These are areas which has to be solved, and they are particularly challenging in Sweden when the university system is federal state-owned and the hospital system is regional, locally owned. And we are really struggling to solve these problems. Thank you very much.
Thank you so much, Professor. And now I turn to Professor Kaljuniemi, please.
Well, good to see you, everybody, and thanks for the invitation to be here. Really pleasure to participate in the discussion. So I'm a professor at the Karolinska Institute of Molecular Precision Medicine, so highly relevant to this topic. I direct the Science for Life laboratory, and as Richard already mentioned, we recently started a major program on data-driven life science in Sweden. So I could actually shorten my talk significantly because so many things that I would have said have already been said, and I would probably just like to highlight a couple of aspects. So as you have already heard, SciLife Lab was launched like 10 years ago as a technology platform. And this has helped Sweden to do things that it would probably otherwise not have been able to do, such as jump into the latest technologies and particularly in precision medicine now go beyond genomics, as already has been mentioned, towards proteomics, metabolomics, single cell, spatial biology. And now then most recently, this data-driven life science initiative focusing on handling the data that comes from all of these platforms and also integrating the data. So this is a integrated, data-driven life science effort where precision medicine is obviously at the heart of things. And we obviously want to achieve the type of real-time implementation of healthcare to individual patients, be it in a maintenance setting or be it in a healthcare setting. And I very much echo the types of things like what Ingemar just mentioned about how this is actually already totally feasible in a research setting, already totally feasible in a translational research setting. But implementing in a healthcare setting is really a significant challenge. As I kind of wonder a little bit as to what could be common topics between countries in this type of a setting, it is also getting increasingly difficult to consider, like you would share samples, you would share data. I mean, that's for privacy reasons and many other legal reasons, increasingly difficult in that sense. But like was mentioned earlier here, it's really what we can share is the challenge of data and challenge of training and recruiting the next generation of scientists that are needed to really take this into reality. And this is really where I would sort of emphasize again this Knut and Alice Wallenberg Foundation funded 3 billion 12-year program that's just started 2 months ago. So we are in the very, very beginning of this program on data-driven life science. And this is really, as much as it's a research program, it's a recruitment program. The idea is to recruit 40 PIs, 200 PhD students, 200 postdocs in this area. And it would also be a great opportunity for exchange sort of talent between the countries and also exchange of training programs in this field. So I leave you with that thought that is probably the lowest hanging fruit, where it's most sort of pragmatic to engage in collaborations without running into major differences in the healthcare systems or into legal and ethical and whatever other troubles that we often face in implementing precision medicine. So thank you.
Thank you very much, Professor. Now I turn to Dr. Arvidsson.
Thanks, and thank you for inviting me to participate in this roundtable. I'm very honored to be here today. My name is Björn Arvidsson and I represent STUNS. We're a foundation for the collaboration between academia, industry, and the public sector in order to create knowledge-based and sustainable growth in our society. So I will try to tell you what I see the kind of needs we need to be further developed in order to advance in the field of precision medicine. And I will, of course, build on what has been said by the previous speakers. I think that healthcare has always been about gathering the available information and with that make the best decisions. And the same goes for business, actually. In Sweden, as already has been stated, it's all about the readiness in the counties and university hospitals, actually, going from idea to implementation, or what the World Economic Forum calls care integration. Where existing approaches are often captured under research rather than implementation, we need to make that shift. And to be more concrete about what we need to do, We need to break down precision medicine into components that are more easily adoptable by the organizations responsible to carry out the integration. I see three things. I see, of course, the health data, which is the foundation for it all. I see reimbursements, and I see the education and training already touched upon as well. Health data is, of course, everything from health records to increased resolution by aggregating with other data sources and using real-time data sharing technologies and big data analytics. All of this that can be accessible at the point of care for providers to guide clinical decision support. In case of reimbursements, I think covering both future quality and cost savings, as Ingmar said, in combination with lifetime benefits, both for the patients or citizens, as well as for the healthcare system. Education and training then, of course, precision medicine requires the attention to patients as unique individuals, taking into account their personal health history, their lifestyle and potential genetic contributions. Providers are well versed in taking personal health histories and accounting to lifestyle factors, but however, the tenets of genomic medicine presents more of a challenge. These are all benefiting from the further digitalization of the healthcare setting using real-time data for decision making. And our organization then, we focus on bridging gaps between different organizations and lowering thresholds. And one such initiative we can do is to relate it to the agenda to support entrepreneurship and growth within the life science companies, where they are in need of being able to generate evidence within the clinical setting or by using health-related or biobank data to develop their products or services. In such initiatives, the healthcare setting will need to look over the ability to meet those needs. In addition, we are, of course, always involved in the development of the national agenda within these areas, both for patient and public needs. Thank you.
Thank you very much, Doctor. And now I turn to Dr. Ani Acharya, please.
Thank you so much for inviting me on to this prestigious panel. I'm Anu Acharya. I'm the founder and CEO of MapMyGenome. And previous to MapMyGenome, I had also founded a company called Ocimum Bio that went on to acquire companies such as GeneLogic. So we started off doing a lot of work, both in terms of informatics solutions, and then had databases which a lot of drug companies and pharma companies use for coming up with precision targets. But we also did a lot of work in the clinical trial submissions to the US FDA. Now, I think Dr. Anurag Agarwal also mentioned that one of the big challenges was the data that you get, which was very heavily Caucasian. I think that was the primary reason for me to move and start this company called MapMyGenome. MapMyGenome is more, we work directly with consumers, but also with hospitals and other partners, because in the future, when we look at precision medicine, we look at sequencing technologies and others, there are many factors that we can look at. Obviously, the obvious ones which we currently do are looking at genomic information, the health history that our genetic counselors look at, and also being able to then come up with specific recommendations that are there. But beyond that, I think when we look a few years from now, and I think I heard Professor speak about symptomics, I think one of the things that we will also start seeing is that there's a lot of consumer-based information that we will have to start considering when it comes to precision health, because we'll start to see a lot more data that is coming in from continuous monitoring devices, whether it's glucose monitoring or otherwise. We'll also start seeing a lot of data that is coming in from other aspects, whether it's nutrition-based or many other pieces. So I think, the bigger challenge, and we are still at the early stages of where we can put in clinical information, but I think by using AI and by putting in other sets of data, I think we'll be able to get to much better sets of, what we can come up with in terms of the value for the end user. And I think since you asked me to come up with a few examples of what we've been able to do, one example that we did was that we've been working a lot on COVID samples for the last 9 months. But the first thing that we did was to go back to our database that we had for a large number of consumer samples that we had, which also with clinical information that we had. And we also looked at a lot of data sources and mined a lot of information from across the world. And we were able to come up with, using some of our algorithms, we were able to come up with some sort of a risk scores for consumers. So one is to be able to use data that you already have to come up with specific things that can help consumers or patients. But the second is also to be able to then say, what is missing out of all of this? And I feel we are still, I think we have to make sure that, as the amount of data sources increases, whether it's proteomics or otherwise, we can learn to integrate this very, very quickly so that we can use that data much more effectively. So that was one example. Of course, the other example that I believe that is going to be helpful is where I think across the world we've seen people collecting COVID samples and trying to able to understand why some people have worked, their genomic information is different from others. I think one where everybody can probably cooperate, and because we also have a lab at the airport, for instance, for doing COVID testing, is to be able to see doing a long-term study, because I think this is probably the first time that we all have so much information and so much data that maybe it would be a good time to look at Sweden and India and look at, some way of being able to look at, understanding of immunity levels for the two countries. So those would be, some thoughts that came to my mind. Happy to take on other questions as they come up.
Thank you very much, Doctor. Now we turn to the next question, and that will be directed to Lars Hammarström, Dr. Björn Arvidsson, and Dr. Amrik Mahal. What collaborations would you like to see between India and Sweden within precision medicine, and what are the potential opportunities? And I first turn to Lars Hammarström, but please be brief because we are running out of time. Thank you.
For having me today. I will try to be brief. My name is Lars Hammarström. I represent Vinnova here today. Vinnova is Sweden's governmental agency for innovation, and we invest roughly 70 million euros annually into research and innovation platforms, infrastructure, and collaboration within health and life science. And of course, precision medicine is a key component of both the Swedish life science strategy, but also Vinnova's strategy for health and life science. So I think much of the commonality that has shown up in the discussions today really exemplifies some of the areas that we can work on together. Of course, the data issues that we have been discussing, access to data is, of course, critically important for research and innovation, but also for the necessary methods that we need to develop for calculating value and reimbursement mechanisms for precision therapeutics that are developed, also utilization of companion diagnostics, etc. So we really need to find new paradigms for data sharing and data utilization, and this requires, of course, both the necessary infrastructure that Rickard was commenting on, development within Genomic Medicine Sweden, but also further development of expertise and training to be able to efficiently utilize that data. And this is an area I think that India and Sweden could really collaborate on developing these training programs and the knowledge necessary for each of our countries. We have great potential in Sweden with our healthcare registries and our national biobanks. But as was mentioned just recently by Professor Acharya, also increasing the capability of utilizing patient-reported data and really making this a part of the collective data that we have is very, very important. We have a very good collaboration today already, a bilateral collaboration with India on if nothing else, AI and health that has been very fruitful during the pandemic. How can we utilize this further than to co-develop data resources and share knowledge? There are also very interesting, I think, ethical and integrity issues related to data utilization that I think that we could co-develop. These are difficult issues that need to be discussed on a very broad level, involving patients, involving the development of ethical guidelines for data utility and data sharing. So this, I think, is also an important issue. We've talked very much about the developments of technology within precision medicine, but as was also mentioned earlier, implementation and scaling of these technologies needs to be something that is really dealt with on a systems level. Much of the technology within precision medicine is being developed or is already there. As Professor Amberg was discussing, we really need to develop the systemic capability to integrate these and implement these technologies into the healthcare sector, and so that they really become of benefit to patients. And as a government agency, Vinnova is very heavily invested in this to make this happen and really try to foster some of these partnerships between academia, industry, but also involving government and the civil sector and patients in that process. The third thing that I would like to mention also is increasing the use of precision medicine also for increased prevention. Utilizing these technologies, moving from precision medicine towards precision health also. How can we use the tools of precision medicine to also promote patient-centered and personalized strategies towards early detection, prevention of disease onset, real-world data-driven screening programs and dietary recommendations and lifestyle interventions, etc. Because we both live in countries where healthcare costs are growing rapidly, and we need to find a way to develop precision medicine in a sustainable way within that context. So I will end there. Thank you very much.
Thank you very much. We go on to Dr. Arvidsson again.
Thanks. So yes, I think as the world's second most populous country and one of the fastest growing economies, India faces both unique challenges and unprecedented opportunities in the sphere of public health. India also has dynamic pharmaceutical and biotechnology industries, world-class scientists, and a good clinical trials industry, leading hospitals, and they attract foreign patients and treat its better off citizens. How India combines these forces for the development of precision medicine is super interesting to follow and to learn from. And I see three things. I will keep this kind of short. First, I see that you work very well in India with the standards in terms of data, and I see that you have an electronic health record standards within something called the National Health Portal, and I think there's a lot to learn there and how we can make medical data portable and easily transferable. I see also what is supposed to become or what is to be the Digital India program, which is also a set of integrating multiple health IT systems, which I think is very interesting and something that we can learn from in Sweden. And also I understand that you have been working for a long time with public-private partnerships, where also I see a lot of benefit for the Swedish development. So it's very good to be here and to look beyond our own system for a moment and reflect upon the development of other countries and inspire from them. And I'm looking forward to the further discussion.
Thank you very much. And now, Dr. Mahal, please.
Thank you very much, Nicholas. Hopefully you can all hear me. So my name's Amrit Mahal. I'm the head of IT at AstraZeneca, and I look after everything in the research space. So for me, there's three things, and it's great to hear a lot of common themes across the panel. AstraZeneca, I mean, we're choosing to partner with the best diagnostic companies out there for our therapies and for all of our drugs. And what we want to do, we know that we're not the experts. We need to partner with the experts who can help us. So we look strongly at selecting partners who've got that regulatory ability as well as that technical ability to really help us develop companion diagnostics. And that's part of our strategy now for all of our medicines to have companion diagnostics. And you need to be able to navigate clinical data as well as understanding regulatory submissions. And what we're really looking for in those partnerships is that understanding of technical, analytical, and clinical data and bringing it together seamlessly. I think the other thing which Anu mentioned really was the plethora of data out there. She mentioned AI, and again, you know, we're all snowed under with this tsunami of data, trying to integrate lots of real world evidence, clinical data. And again, I think this is where collaborating with India really helps us, is that intersection of science and IT skills and how can we really tailor that and how can we use that to really work through all of this data and look for those golden nuggets. The final one that I'd just like to mention very quickly is Professor Ollie mentioned the low-hanging fruit. This exchange of talent and training programs, absolutely. You know, we're working at AstraZeneca with Business Sweden on talent attraction. It's a collaboration with Vinnova, and this is an easy one for us to really try and highlight. How can we move some of this talent between countries, and how can we learn from each other? And really to support that as well, what AstraZeneca have done is also at the end of 2019, we launched our Health Innovation Center in India. So Leif Erikson, our chairman, opened that center. And again, we're seeing great returns on that. We're seeing great interaction with lots of startup companies over there. We're putting out innovation challenges, and it's amazing the ideas that we're getting through. So just to nurture all of that is a great opportunity for us. Back to you, Nicholas.
Thank you very much. For the interest of time, I will let the next question go solely to Professor Kuldeep Singh. What governmental support would be required to attract more industry, academia, and B2B collaboration in this domain? And what infrastructure is required to enable collaborations? Please, Professor Singh.
Thank you, Nicholas, for inviting me. I am representing AIIMS Jodhpur for this India Innovation Center. And first of all, I would like to thank the Business Sweden and the Sweden Ministry for establishing the Innovation Center, Innovation Hub at AIIMS Jodhpur. And also there is a live Center of Excellence for Oncology, Comprehensive Oncology Care. And the third is going skill for scale for some of the metabolic disorders. I would like to apprise you that the AIIMS Jodhpur is the first institute, first AIIMS in the country in 2013, going the electronic health records. HIS system was established. And I think establishing at the first stage is very helpful, because one of the component of the precision medicine is the record, data, electronic health record of the patient. So we have that record. And I think this is made to be more robust because in order to utilize this in a better way. So that's why the government agency should not target about how to make the digital health mission a reality. And that is going to help in the collaboration also. And also this will attract the industry people to work in this area so that they can validate their startups or initial innovations. So I think this infrastructure which is going to be developed with the help of this digital health mission is going to be integrated with the genomic medicine. And I agree with Dr. Anurag and Dr. Sudeep Gupta, that is the cluster-wise collection of the data or short collection of the data will be helpful in order to go for the longer and larger data, which can be like used for the genomic studies. And ultimately the genomic combination with the health records, lifestyle and the deep phenotyping will help in improving the health care of the country. And in this way, more of the collaborations can be attracted when we establish this simple infrastructure of a digital health in the hospitals. Thank you.
Okay, thank you so much. I will now just, as the time is running, we will just have the last question to all in the panel. If you have just a few seconds to answer that, what do you bring from this discussion, and how will you be able to contribute to a better collaboration between Sweden and India in the field of precision medicine? So we could start from the top, and I'll see. Well, we could. I just mentioned Professor Kailiniemi, please.
Very briefly, I think there's a lot of common ground and we should definitely move forward. And like said many times already, that the training initiatives and the common challenges in data would be my favorite bringing forward, and we're happy to engage in collaboration.
Excellent, thanks. Anders Blank, please.
Thank you. Building on the same note, I think there's a huge potential for more collaboration between Sweden and India. It so far has been very successful. I think we can definitely build on the more collaboration in the health data space. We can do more when it comes to joint programs for education and industry postdocs, for example, building on health data and AI analytics. And I also think that there's a lot to learn from, the ongoing very successful collaboration on biopharmaceutical production, actually, that we have. Sweden is strong in that one, and so is India. How can we improve that even further? So thank you for a very fruitful meeting. Thanks.
Thank you very much. Professor Ernberg, please. Dr. Arvidsson.
Yes, thanks. I think a lot has been said. I think one of the major things for good relationship is, of course, that it's always between the individuals, and meeting like this is always a good way to find collaborations because it's not between different brands or different companies. It's always between people, and I think if you remember that, it's always easier to build good trust in such relationship that will actually be to our benefit in terms of innovation and to go further with collaborations. Thank you.
Thank you very much. Dr. Acharya?
Yeah, I think one of like I mentioned earlier, is to be able to see if we can take certain examples, whether it was COVID or something else, and see if that data can be collated to get better insights from the two countries. The second is to be able to see if we can come up with better standards of data sharing between countries, because in the end, I think health is a global problem and not a country's problem only. So if we can come up with better ways of articulating those specific data sharing standards between the two countries, I think that would be a key element.
Thank you very much. Mr. Hammarström.
Yes, thank you. I think it would be fantastic to build further on the joint declaration on the Sweden-India innovation partnership that has been developed. There are a number of bilateral academic collaborations also that we funded at the Indian Institute of Technology, University of Delhi, the National Center for Biological Sciences, etc. So really building on these bilateral collaborations where getting to know each other is often a very important first step. So I look forward to that, and also the work that's been done on AI and health within the COVID scene.
Thank you very much, Dr. Mahal.
Very similar to what Lars has just mentioned. I think this is a great opportunity on this panel to listen to what each of those doing. I think the work between India and Sweden and the channels available for us through Business Sweden, through Vinnova, that's absolutely fantastic. And I think I'm looking forward to certainly connecting with a number of the speakers on the panel afterwards and see how we can work more closely.
Okay, thank you very much. And finally, Professor Singh.
Yeah, I think a continuous dialogue, and as everybody has said about this privacy about the data and the handling of the data, blockchain and other system. So the robust patient safety can be maintained with the help of data. At the same time, it can also help in nourishing the collaboration between India and Sweden. So I think this is a time to continue with the dialogues and idea exchange. We have a lot of things we can provide from our country, and also there is a lot of hope from the Sweden side. That is, we can get a lot of technological support from that Sweden side. We have the clinical material, and we have a clinical variability also. There's a distinct genotypes in our country also with different ethnic groups. So in that way, the collaboration will definitely going to work between two countries. Thank you.
Thank you very much, Professor. As time is running, it's time to try to start to sum up. I will just thank everyone for a very, very good discussions. I would like to thank the Department of Biotechnology in particular for inviting Sweden to this roundtable discussion together with you. It has been very interesting, and it is clear that Sweden and India have everything to gain from collaborating in the field of precision medicine. This was the first discussion, and we hope that this can lead to new innovative solutions created by the participants from both our countries. I will just pick up to what Professor Kuldeep Singh of AIIMS Jodhpur just mentioned, that we are very interested to further develop the India-Sweden Health Hub in Jodhpur, and we will get back to you shortly on that. A special thanks, of course, to both ambassadors, the secretary, speakers, the panelists, and observing participants for all of these interesting discussions. So thank you very much, and a good evening to you all.
Thank you very much.
Thank you. Thank you. Thank you.